Welcome everyone to today's Connect 360 Learning Series webinar, Discovering True Transparency in Pharmacy Benefits, presented by Rightway in partnership with the Business Healthcare Group. I'm really delighted that you're joining us this morning. I think, as we think about pharmacy benefits, they've really become one of the least transparent and fastest growing cost drivers in healthcare. Employers are searching for solutions that provide greater transparency and assist their members with navigating their pharmacy benefits. As of January 1st, the Business Healthcare Group has selected Rightway as our partner in pharmacy benefits, really because their solution supports employers with a fully transparent model and high-touch guidance for their members. Today, Rightway will share their model and how they are reshaping the pharmacy experience, delivering better outcomes for members while restoring cost clarity and accountability for employers. We encourage you to submit your questions throughout the session in the chat feature, and we'll address as many as we can at the end. But with that, Greg, I will turn it over to you and the Rightway team. Thanks.
Yeah, thank you for the introduction. Excuse me, I'm battling a little cold here, so I got a scratchy voice. And giving us the opportunity to speak to you all today. We look forward to it. I recognize one name. I see Kate. I think you're on the call. Good to see your name. I brought a small team with us today. We're going to take a team approach. We're kind of really just going to give you a high-level overview or capabilities presentation of Rightway's model. And you can see from the agenda here, we'll start with our VP of our enterprise sales, Chris Bernal. Will kind of give you, how did Rightway come about? What is our business model? How are we trying to differentiate in the market? We'll hand it over to Maureen. She's on the front lines answering calls of members. And how does our member services model differ? Because we do hang our hat on that being a key differentiator for Rightway. I'll briefly talk about our implementation. I won't spend a lot of time on it. We can get granular in that on its own separate call, but I'll give you some high-level things that we do to ease the burden and do the heavy lifting on behalf of your benefits team to get you up and running. I'll briefly talk about, Chris and I will talk about client success. How do we manage you as a plan sponsor? Because we are member obsessed, but we want to be client obsessed as well. Brian will talk about our clinical strategy. That is another big differentiator. We feel the traditional model has conflicts of interest to really truly manage it from a clinically appropriate perspective. And then I'll briefly touch on some advantages of partnering not only with Rightway, but with Rightway and BHCG. I know an hour goes by quick. But hopefully we'll have 5 or 10 minutes at the end. If not, by all means, we will follow up with any questions we're not able to address during this presentation. Janet, or I guess anybody, if you want to type in a comment, if there's something else you want to make sure that we cover, let me know. But if not, I'll hand it over to Chris here in a second. Janet, anything you see here that, or anything you want to add?
No, honestly, thank you.
Cool. Well, with that said, Chris, I will hand it off to you to tell our story and how we came about.
Thank you, Greg. Nice to be with you all today. Greg has his Rightway quarter zip on. I had to swap mine out for a Texas one today in honor of the Sweet 16. I know based on where you all are, there's probably some Big Ten fans in there. I know it's very well represented, but thanks for taking a few minutes today to talk with us. We're very excited to go over Rightway and talk about who we are and hopefully how we can help you all out. So as a starter, we actually got our start about 9 years ago or so, and we didn't actually initially begin only in pharmacy. Our focus was really to help people because as Greg has talked about, our whole goal with anything that we do is to be member obsessed. So those people that stand in need of anything at the moment that they need it, we want to be there to help them because the healthcare system can be confusing. It can be frustrating. Even people who work in healthcare can have some issues. But I was just talking to someone whose wife just had a baby here at Rightway, and he had some major issues with billing and not being recognized with being on a plan and all these sorts of crazy things. And so our initial goal was to say, let's be there for people and be that doctor and that representative in the family for every single person. And so we started as a concierge healthcare navigation company, which still exists today and is still a very strong part of our offering. And that's where if people need help, if they need to find a doctor or a specialist, or they have a question about billing, anything that they need, they come right to us. And that same, I would say, methodology or format is persistent, as we'll talk about today, with how we operate our PBM as well. But the whole goal is get a real human, because in the moment when you need something, think about, I mean, a lot of people, if you've been traveling, it's a little bit of a stressful time, especially now. And how often when you need to get a hold of someone, you think, oh, great, I'm gonna have to either go through a bot for a while, or I'm gonna have to sit on hold, or go through an IVR, like those phone trees where you push different buttons. We wanted to say, look, in that moment, we want to actually be able to help people. And so we want strong trust and strong alignment from your members. We know that for many of you out there, this is one of many, many things that you're dealing with the healthcare, with pharmacy. And so we also understand that you're probably inundated with a lot of questions from your members as well, and from people that are working there, maybe escalating to certain executives, and they come over to you, and you're tasked with trying to figure out what people are even asking. And so we wanted to really be that front door of any question that you might have. I actually have used it for myself. My daughter does gymnastics and tumbling and dance, and hurt her hand. And so I said, hey, we need to find an orthopedic specialist. And they put together a full list and sent it over to me. And so the idea is that we're able to take off some of that burden. And then for the plan sponsors, make sure that we're able to get people to the spot that they need in the most cost-effective manner as well. As you all are probably seeing yourselves, a huge component of spend that continues to grow at an alarming rate every single year is pharmacy. I was just at a conference last week talking to people about pharmacy, and there were actually a number of other vendors that had nothing to do with the pharmacy space. And they said every one of our conversations actually starts with pharmacy, because people are saying this is the core part of their strategy, is how do we manage the cost of that? And how do we even understand what we're spending? And are we spending it the right way? And we realized very quickly that the PBM system, as our other parts of the healthcare system, was broken, and there wasn't really good focus on the members, and there wasn't a lot of trust. And you can see that if you open up the headlines and look at anything healthcare related, it seems as though there is either a new suit brought or some kind of quiet settlement that is happening on a weekly basis or a bi-weekly basis at the most. And so what that ultimately means is that you as plan sponsors feel like you're just a powerless, almost victim in this system of how do we possibly make this better? How do we even know if we're getting the right service, let alone the right cost on top of that? And so we wanted to come out and fix all of those things. So take that same exact methodology, that same DNA that exists on our care navigation side, and be completely, as Greg said, member obsessed. So if people have any questions on the pharmacy side, that they know where they can go, they can trust the answers that they're getting, and they get a real human. And on top of that, we'll talk more about this, but it's actually a trained human. It's a pharmacist or a pharmacy technician. This isn't just some random phone system or someone that's there to answer questions on a chat for you. It's people that actually know what they're talking about. And then on top of that, for each of you, we want to be really, really good, strong, trusted partners. And part of that, as fundamental as that sounds, is making sure that we have an aligned financial model with how we make money as a company, but then also how we partner with you. Because as you dig in and understand more of the pharmacy, this is even true for us. The more you learn, the more you realize you don't really know, or the more you realize it's just very intentionally convoluted and confusing. So people are making money at every single step or chain of this process, whether it's the pharmacy that they're steering you to, or the drug, or where on the formulary the drug is being placed, if the rebate is being fully passed along to you. I don't know if you're anything like me. I actually used to lead Total Rewards. It's very difficult to make sense of your rebate reporting, and it's also very, very much on a lag and delayed. So what we want to do is to say, look, we're going to charge you one flat admin fee. That's it. So you know that that's the only way that we make money, and everything else that we do, anything else, is basically to promote the best experience, open market competition to get the very best service, and we don't make any extra dollars on anything else that we suggest. So whether we're sending you to a certain pharmacy, it's because that's what's best for the member, the best opportunity that we've identified for the member. If it's a biosimilar or a generic, we're focused on the actual net cost rather than this weird broken game of rebate chasing. So Greg, if you want to go on and as we go through this presentation today, that's what I really want you to think about, is that we are anchored in a model that is really meant to be very helpful for your members, that they will come to you and say, this is awesome. When I had a question, when I needed something, I was able to get the answer as soon as I needed it. And then for you, you feel like there's a very strong, trusted partnership where we are here in your best interests. we're here in your members' best interests, and we're there to help. And then on top of that, that we're coming, whether it's through QBRs or through some self-service reporting or anything, you're able to find ways to have your plan perform as efficiently and cost effective as possible without putting at risk that end member experience. And then because we're an upstart of sorts, we've been around, like I said, for almost a decade, but an upstart compared to some of these other PBMs, we are very, very agile, and we are built on a very modern technology platform. And so we're excited to show you what that exactly means. It's very human first. So when people are getting in touch with us, they're going to talk to a person, but there's a lot of technology in the background, whether that's when they're calling in or especially if people want to keep tabs a little bit more passively on our app. So very excited to talk to you. Greg mentioned this, but I'll say it again. At any moment, feel free to come off of mute and ask us any questions. I'll be monitoring the chat and kind of jump in as well. And we'll take you through that experience of what our member journeys might look like, and then also how we work very closely with your team. So very excited to be here today, and grateful for the chance to spend a few minutes.
Thank you, Chris. If there's no questions, I don't see any in the chat. We're going to hand it over to Maureen to walk you through how do we deal with interact with your members on a daily basis. Maureen?
Hi, thanks, Greg. Hi, everyone. Maureen Biltz, Senior Pharmacy Manager for our Pharmacy Navigation team. So I lead the team of technicians and pharmacists that interact with our members on a daily basis. I am a pharmacist by training myself. So I've been behind the scenes, but also on the front lines with members, patients, counseling them, walking them through their benefits. So excited to be here today to talk about how Rightway elevates the member experience, but most importantly, why that matters for our members and for our clients. So as Chris mentioned, our pharmacy navigation team, one of the most important things about our team is that our team is made up of clinical experts. So we staff our team with nationally certified pharmacy technicians or licensed pharmacists. So all of our members who interact with our member services team, are interacting with team members who have worked in pharmacies, who know about medications. We really feel strongly that by building our team with knowledgeable people, that allows, our members to be helped in those moments that matters, build trust with us as a team, and really help navigate them to the best healthcare solution. So when I think we can all agree, pharmacy benefits are confusing and hard to navigate. So, when I think about the traditional PBM model and their customer support center, a member may reach out with a question about a high cost medication or a medication that's not on formulary. And really what they're met with is just being provided information, delivering information to that member, referring that member back to their provider or their pharmacy, and not really hand-holding them through the process in order to, at the end of the day, access their medication or another medication that may be covered. So, when we talk about how pharmacy navigation is so different from the traditional models, it really starts with that clinical staff. When we have a member reach out about a medication, I'll use, an asthma inhaler as an example. When they connect with our clinical staff, our staff are asking questions to help determine what that best solution is for that member. So if we have a member reaching out who has a child whose asthma medication is high cost or non-formulary, the pharmacist may be looking at the child's age. Is this a new medication? Have they been on it before? All asthma inhalers are not going to be appropriate for pediatric populations. The way it's administered might not be appropriate for a pediatric member. So, we have our clinical team asking those questions and then making those appropriate clinical recommendations. And that's really the first step. How we really elevate that experience beyond that first step, though, is then hand-holding them through all those time-consuming steps that need to take place for them to then access that medication. So for that child's inhaler, we're asking the member, what is your provider's name? We'd be happy to reach out to them, talk about these alternatives, request a new prescription be sent to the pharmacy. Once that prescription is sent over, we're following up with the pharmacy to make sure it's processing through the correct insurance. The pharmacy has all the right processing information, finding out, does it need to be ordered? Will it be ready that day for pickup? And then just keeping that member informed along the way. Hey, we reached out to your provider, we connected with them. They're going to have the doctor review and send over a prescription if appropriate. Hey, we spoke to the pharmacy. They said they have to order the medication, but it should be ready tomorrow by 2 p.m. So really taking all that work off of the member. And what we find overall is that this just leads to a better member experience. We drive toward better satisfaction, which you can see with our NPS score, awareness, access, affordability of their medications. We can redirect members to lower cost medications, both benefiting the member for a lower cost and also the client. The plan may have lower costs by us able to redirect members to preferred generics or preferred brands. And so you can see that through, our service numbers. So we really feel that leads to kind of this enhanced member experience that our team strives to deliver. And so, can't talk about delivering a better member experience without talking about how we train our staff, since, we say this is different than the traditional PBM. So we have a lot of steps in process in order to prepare our staff to deliver this outstanding member experience. All of our technicians and pharmacists go through, our Rightway training program, but it doesn't stop there. We continue to work with our team, educate our team. We have quality assurance in place where we are continuing to evaluate our team, how they're delivering customer service to make sure it is top notch. We also, one of the important things we incorporate is working with our client success team, which you'll hear about. But we work with our client success team to understand what our clients need, what their expectations for their member experience is. So we build in, cultural training from clients, make sure we are understanding the benefits, how it's designed, how the messaging that the client wants delivered to the member. And we continue working with our client success team on making sure that we are delivering a member experience that meets the expectations of the plan. I know that was a lot of information. Before we go into the demo, just wanted to see if there were any questions related to the navigation team or how our member experience. All right, if not, I'll turn it over to Greg. For the demo of our Rightway app, I will just tell the team this is the easiest way for our members to reach out to the navigation team through chat, although we will always meet members where they're at, whether they prefer phone or email. But what I love about the Rightway app is that it offers a lot of self-service and encourages members to understand and utilize their benefits, but it's always backed up by that clinical approach in which members can always access the pharmacy navigation team for that hands-on support. So Greg, I'll give it over to you.
Thank you, Maureen. Appreciate it. So yeah, I think this will give you a good visual of everything that Maureen's team does on a day in and day out basis. This is a visual of our mobile app, but as we said, we are human first. Members can always call us simply by clicking on that. Phone number comes up. they will get a live rep. They don't have to go through a 20-button telephone tree to get somebody live. Chat is a very popular function as well. Members can come in and chat, and they can multitask and do other work on the side while they're working with our care navigation team to help address their pharmacy issues. Or they can simply send an email too if they have time on their hands and they don't need a immediate response. But what you see here can also be viewed like if you're like me and your eyesight is going as you get older. We understand that everybody likes to use their phone to research stuff. Everything you see here, you can access via a laptop or a desktop as well. But what we are looking at here is what's called the medicine cabinet. Every time you or one of your dependents has a prescription filled, you'll be able to view it in here within minutes after the pharmacy processes it. But let's go through a couple examples of what we call or what we look for are those moments that matter. Where can we help navigate members to lower costing drug alternatives? In this particular scenario, I'll be the dummy patient. I'm taking Lantus. If I click on it, I can see what I'm paying today. We always show where you're getting it today, which in this case is your CVS. You're paying $42 a month. But right away, we do also use AI with our modern technology behind the scenes to help us identify lower net costing opportunities. So it looks at all of our contracted rates within our pharmacy network, and it'll kick out, hey, Greg, if you want to move down the street to Costco, better yet, here's a map view, and we'll highlight where that lowest costing pharmacy is. You can save $4 a month, $50 a year. You know, I'm a realist, that may or may not be enough for somebody to switch pharmacies. We all get preferential towards certain pharmacies that are near us. But the bigger savings opportunity that I think I will have to strongly consider is Lantus is currently considered an excluded drug on our managed formulary with exclusions. But our system will pop in what our preferred alternative is, which in this particular scenario, it's glargine insulin. So rather than paying $42 a month, if I'm willing to switch to Rightway's preferred drug, I would get it for $15 a month. Well, now that's pretty substantial, right? That's a $27 saving per month. You know, you annualize that over 12 months, that's $300 in savings by changing drugs. But here's where we try to differentiate ourselves, and here's where we do differentiate ourselves. Rather than just sending me on my way and saying we did a good job, we identified a lower costing drug. No, would you like to talk to Maureen's team, who in turn will make an outbound call on your member's behalf to their physician, which the fact that our whole care navigation team consists of pharmacy technicians and pharmacists, we feel doctors are more willing to speak with us because they've all worked in a retail pharmacy setting. And then they'll help in turn, if the doctor agrees, get that prescription back to the member's pharmacy. The number one question we get is, well, who are you to tell my doctor, what drug I should take? This is voluntary. Members don't have to do it. They could continue on Lantus and continue paying $42 a month. But we feel it's our job that when there is a savings opportunity to help members do that. And the fact is, there's over 10,000 plus national drug codes or drugs in the market. A lot of these doctors maybe know 10 of them, 15 of them really well. So when we have a good explanation for changing, which, by the way, it's over 80% of the time that doctors agree with us and do change that medication. Another quick example to show you, I'm also taking the citalopram, just like the last one. We'll show what you're paying today. I'm paying $21.25. In this case, I'd only save 18 cents by going to Duane Reade. I wouldn't change pharmacies for 18 cents. I would probably just stay at the Target. But the bigger savings opportunity is, in this scenario, I don't even have to change the drug I'm taking. I just have to change where I'm getting it from. Since the citalopram is considered a maintenance drug, it's the cheapest place to get it is through our relationship with Mark Cuban. So not only would they pay $3 less, but they would get a 90-day supply versus what they're paying for a 30-day supply. So if you do the math on that, if you're paying $21.25 times and you get it 3 months in a row, that's $64 rounded versus only paying $18.25 every 90 days. So, pretty substantial savings there, and you don't even have to switch drugs. Just like the last scenario, would you like to talk to Maureen's team that will call your doctor? They'll help you get an account set up with Mark Cuban Cost Plus. Bear with me 1 second. What else? Another cool thing that I always like to show up here, you can actually be proactive. Let's say you just I was at the doctor's today. Doctor writes me a script. I can do it while I'm at the doctor's office. I can do it while I'm in my car. I can run a test claim to find out where is the cheapest place I can bring this script. So let's just take atorvastatin, very popular cholesterol lowering medication. You key in your home address, you fill in all this day supply, form, dosage, units, and then search. And our system will do the heavy lifting for you. No surprise, atorvastatin is also a maintenance drug, that the cheapest place to get that is also through Mark Cuban mail order. However, we do know that not everybody loves mail order, right? Some people like to drive to their local brick and mortar. So we'll also sort down at the bottom here where the cheapest retail pharmacy is. So you can see too, we've taken a step further that without their Rightway card, we also show what the cash price is. So it helps reinforce the benefit of that you're offering your membership. If you were to implement any of our ancillary programs, for example, we have our own GLP-1 program that Brian will talk about here shortly. We have a diabetes program that Brian can touch on. And we're working on some new direct-to-consumer programs too around weight loss and other things. They would pop up here as well if you were to implement them. The other cool thing, they'll always have a virtual ID card. So at no time, as long as they have their phone in their hand, they'll be able to get a script filled with this virtual ID card. For those on a high deductible health plan, we monitor where they're at within their deductible and maximum out-of-pocket phase. There's a copy of our formulary here. Again, if you're in your doctor's office and you were to partner with Rightway and you see your doctor's about to write your prescription, hey, doc, can you look at this Rightway's formulary before you prescribe this to make sure that it's either a preferred brand or, of course, a generic, so I can get my cheapest price. I don't remember Chris touching on it, but one important thing to note, we have strategically chosen not to own our own distributing assets. And by that, I mean, we do not own our own mail order facility. We do not own our own specialty facility either, because we feel that creates a conflict of interest. We're going to be motivated to drive membership to our own facilities. We rather have what we call, or I call, kind of an open network philosophy, where as new innovative distribution models come to market, we can add them to our network because we don't have any conflicts of interest, because we don't own our own. But we have chosen to partner with Walgreens as our quote unquote primary mail order and specialty distribution facility. But as you saw, we were one of the first, I think we were the first PBM to partner with Mark Cuban Cost Plus as well. Again, as new ones come out, we'll have the ability to add them. And then if you had any other third-party vendors that you partner with, musculoskeletal, mental health, smoking cessation, we can kind of add them to our mobile app too, to enlighten and educate your members that they have these other programs. I will pause there for any questions that might have generated.
Greg, hi. I put a question in the chat. I think the app is really innovative, and providing this information to members can be really impactful, but only if they make a change of medication or location. Do you have any data on the number of individuals or the percent of individuals that take advantage of these opportunities? And then a second follow-up question is related to how Rightway supports employers in educating employees to maximize the impact of the Rightway solution.
Yeah, so the metric we have been measuring is when we have a lower costing opportunity and we present that to a doctor, it's over 80% of the time that they accept that recommendation from Rightway. As far as education, like that is a big part of our implementation process, really determining what your goals are and how we can best communicate that to your membership. And we usually do that through a multimodal communication process, mailings, via email. We can help with poster boards for workrooms, although that is somewhat old school, many people would say. So it's a multi-pronged approach that we can help educate your members on using the app, and or if they don't want to use the app, simply calling into Maureen's team to have our team do it for them while they're on the phone. And then Brian and our clinical team, to take it a step further, we're working on implementing into our client portal, which I'll talk about here in a second, the ability to help plan sponsors model if they want to make a benefit design change, or if they want to, for example, on weight loss, we will often do copay waivers, or we recommend those to help drive membership towards these preferred and or cheaper brands. So these are all conversations that we would have during the implementation process. Hopefully, did that answer the question, Janet, you think, or?
Yeah, I think so.
Cool. I'm going to do a little audible. I know we're at just past the bottom of the hour here, but I'm going to skip over implementation and client service for now and go to Brian. It's important that you hear about our clinical philosophy in the event we do run out of time. So Brian, I'll let you take it away, then we'll jump back to me to go over implementation and client success.
Sounds great. Thanks, Greg. So hello, everyone. I'm Brian Thone, Senior Manager of Clinical Consulting and Plan Performance here at Rightway. So that means that I'm also a pharmacist by background, but I work with our client success team closely with them and our clients and consultants to basically, provide information about the Rightway processes and really how to, dial in the benefit to really, capture the most savings and generate that lowest cost. So wanted to talk a little bit about our overall formulary strategy. After that, we'll get a little bit more into the details of biosimilars and GLP-1s, since those are obviously kind of the biggest questions of the day right now. So in general, Rightway is looking for the lowest net cost. So what does that mean, and how does that compare to another PBM? Looking back at my career in dispensing, there's been a decade where we've still been dispensing brand name Adderall XR, brand name Lantus insulin, like Greg showed in that demo. And really, Rightway is kind of just untangling all of those different relationships and ways that other PBMs can kind of hang on to those rebate dollars. So the way that we do that is if there's a generic on the market, or usually multiple generics is when the cost gets much lower than the brand, we go ahead and update our formulary and cover those generics and make the brand name either non-preferred or not formulary. So that may look a little bit different in terms of the financials. So your rebate checks may get a little bit smaller, but ultimately your net cost is going to get lower as well. So you're paying less out of pocket up front, getting a little bit less back on the rebate side, but ultimately you're saving money there. The nice thing about this model is that we own it and we manage it from beginning to end. So we have our own formulary. We have all of our utilization management, which is our prior authorization reviews, are all done in-house as well. And then we partner with Maureen's team. So when we have formulary decisions or prior authorization tasks that need to be done, that team also supports, and they're able to educate the member through that process as well. So generally, when we're looking at a transition, so a new client coming onto our platform, a lot of what we're doing in terms of changing medications, which is really what a lot of people are worried about, hearing noise from your members. Most of what we're seeing is changes from a brand name product to a direct generic, so exact same medication. Some of the other ones we see are just combination drugs or over-the-counter drugs that have been covered in the past. A lot of dermatological, acne products where there's 2 ingredients in 1 tube. Well, you can get those 2 tubes separately, and it costs you, 10% of the combination product. So that's a lot of what we're doing when we're kind of adjusting members' treatment as they're coming on to the Rightway formulary. So moving down into our clinical policies, so that's our utilization management, so kind of the prior authorization process. So there, we do follow clinical guidelines, so we're not really restricting anyone in terms of getting the appropriate therapy that they need, but we are going to follow those guidelines and go through those first step options. So we're not going to jump right to an expensive brand name specialty product if nothing else has been tried before. So we're going to go through the methotrexate before you get on to an Enbrel or a Humira or something like that. So with that process in place, again, we're steering to those lower net cost options. So when a member is new to the plan or starting on a new medication, we really do have that intervention there where we can generate those cost savings as well. And a nice thing about that system as well, I worked for another PBM in the past in the utilization management. Their standard turnaround time for just a regular request is 14 days. Their appeals can be 28 or 30 days. It's much different here at Rightway. Our standard turnaround time is 3 days and our appeals are done in 14. So really cutting down that amount of time. Have lots of visibility for members in that mobile app so they can check in and see the status of their prior authorization. If it gets approved or denied and they have questions, they can easily just click a button and chat with our team. And we can educate them. If something was denied because there's a preferred alternative, we can chat with that member, let them know, hey, it looks like you haven't tried this other medication first. That really is kind of the first line therapy. If you'd like, I can reach out to your doctor and get a new prescription sent over to the pharmacy. And then, if that doesn't work, we can revisit and go through this PA process again. So really, again, tying back into that pharmacy navigation team that Maureen leads. And then lastly, Greg touched on the clinical programs as well. So I'll get a little bit more into this with the biosimilars and the GLP-1s. But we do have these programs that, again, are tapping into Maureen's team. We also have other nurses and dietitians for things like our weight loss program. We're really checking in with members consistently. So a lot of the spend that's going into GLP-1s, both for weight loss and diabetes, a lot of that is just kind of thrown away because these members are not continuing on therapy. So they might fill it for a couple of months. You're spending thousands of dollars to cover it. They stop the medication because they have nausea or GI upset, and they really don't get the long-term benefits that we're looking for. So again, tying all that back again, all this stuff is in-house. We really work well with those different teams to support the member and also drive those priorities of the plan as well.
Brian, did you see the question in chat? It says, do you see disruption when implementing clients, and how do you work with employers and their advisors to manage member disruption?
Thank you. So typically our disruption is less than 2%. So disruption meaning a member actually needing to change medications. So for some of those things like the OTCs where they can still access them outside of their benefit or switching to a generic, we don't consider that a true transition. So typically less than 2%, which is usually about what you would see if you stay with the same PBM. So they're going to be updating their formulary on a yearly or twice a year basis. And you may have changes that go into that. So typically not seeing much more than just a year over year change. Our team does support that. We will work with our clients in advance. So we'll go through every single drug category. So whether it's drugs that are not covered on our formulary, but you have members taking them, drugs that are on our formulary but have a prior authorization or a step therapy, we'll go through all of those with our clients and just kind of discuss, GLP-1s for diabetes. Would you like to just approve these indefinitely, or would you like us to re-review and make sure they truly have diabetes? If it's something that's a non-formulary drug, we can do grandfathering, which is very flexible. So we do a lot of 3-month grandfathering up to a year, sometimes indefinite. So you really have options there to manage. So one example there would be like a birth control medication. Usually a small number of members are on a brand name product, but they've already gone through and tried lots of other options. So in that case, we can kind of pull those out and say, what, let's not mess with this small group of people. We'll just give them, an indefinite approval. So we have lots of flexibility there. You'll work with a pharmacist to go through that transition process along with the implementation manager and really tailor it to your specific needs.
I'll take it a step further. We'll get an open file from your current PBM2 to identify members that might be taking what would be considered a non-preferred or excluded drug on our formulary. And then we do proactive outreach ahead of time. We'll get an open refill, mail order, open refill file from them. We'll get an open prior authorization file from them. And that's all built into our implementation timeline.
Yeah, thanks, Greg. So I think, right here is great. So here we're looking at kind of an example of biosimilars. So just to pull back a little bit, our strategy around biosimilars is basically the same as it is for generics. So, the first one that hits the market generally is not providing a ton of savings. But once there are multiple out there and there's some competition, you really see drastic reductions in costs, usually greater than 90%. So it's the same for generics as it is for biosimilars. Again, going back to that Lantus that Greg mentioned, that's a biosimilar, the Semglee that we prefer. They've been around quite a long time, but we're really seeing this big impact now on these specialty medications. So specifically Humira and Stelara. And Stelara is the example that we have up on the screen. So you can see on the left side of this bar chart, it's about $20,000+, $24,000, $25,000 a lot of times for this drug, but a very significant chunk of rebate that comes back to it. But ultimately, you're still spending about $12,000. So we did have some white labeled biosimilars come out when Stelara was first announced. So they were basically made by a PBM specific to their population. So you can see significantly less cost there, still a significant rebate. But that out of pocket is, for the plan is still, about $3,500. So what Rightway chose to do with the Stelara biosimilars was wait a little bit and see what else was going to come out onto the market. What we found was Otulfi came to be available very shortly after. I think it was a matter of about 6 weeks between those white labeled options and the Otulfi. And you can see that the price is $900. So very, very significant savings just by being patient, waiting to see what the market does and really choosing that lowest cost option. And it didn't stop there. So we had Otulfi on the market almost a year ago. And then just recently, we had a new product approved called Stargemza. So you can see there about $410 for this one, even more savings there as that market develops. And the cool thing here is this one was originally available through Mark Cuban Cost Plus. And because they had this lower price point, Rightway was able to reach out to our preferred specialty partner, Walgreens, and just say, hey, Mark Cuban's offering this for $410. Can you match that price? And they agreed to do that. So now we have multiple channels available for these really low cost biosimilars. And we are expecting some coming out in the future. Symphony, Prolia are the ones in the next couple of years. It'll be a little longer till we see things like Enbrel, which is a really high cost medication, as well as Skyrizi. But what our plans are seeing so far with these are really, really significant savings as soon as they make the change over. And we can do that, when a plan comes on for the first time. We can also do it mid-year within about 60 to 90 days. We can also make a transition. And that goes for most things with the plan. If you need to make some sort of an adjustment, usually that 60 to 90-day period, we can make those changes for you. So let's jump into GLP-1s, Greg, one slide forward. Thank you. So here, kind of looking at the 3 different categories where we see GLP-1s utilized. So we have in the top left there, diabetes, which is the original indication. We also have weight management, and then we have that cardiovascular, those kind of secondary comorbidities that come along with both of those. So, Rightway's strategy is really to focus on the triple risk. So we're focusing on those that have diabetes and cardiovascular risk and are likely overweight as well. For the diabetes, as I mentioned with our transition, we've seen a lot of PBMs that were not really managing this diabetes usage well. They were taking, just an attestation of I have diabetes, therefore this should be covered. And a lot of those would get covered. They were also covering pre-diabetes or gestational diabetes because they just weren't looking at chart notes. So it's a little bit different here. We do verify member actually has diagnosis of type 2 diabetes, and they've also tried an oral medication already. So again, following those clinical guidelines, not just jumping on GLP-1, putting GLP-1s in the water. Moving over to the weight management side. So this is one that's an option. So you may be covering it now, may not, maybe considering, changing, either adding or removing. And we can work with you on that. So we have lots of things around weight management that we can do. So we can do flexible cost shares. So whether you want to have certain people pay a little bit less if they're involved in a clinical program, either a third-party point solution that you already have in place, or working with Rightway's Care Complete program. So that Care Complete program we have for both the diabetes and the weight management side. Not to get too much into the details, but again, we're checking in with the members very regularly. It's a team of healthcare professionals that are supporting them. And really the idea is to help these members stay on these beneficial medications by coaching them through their diet and exercise, by ramping them up slowly on medications, and even deprescribing. So if they're reaching a weight goal or a blood glucose goal, potentially being able to deprescribe and have less medications, we can also kind of taper those doses down again. So we do kind of have that member obsessed approach in this area as well. And then lastly, just to touch on the newer kind of expanded indications for GLP-1s, we do have lots of things for cardiovascular risk reduction, things like that. The question does come up often, but the 2 primary diagnoses are diabetes and weight management. Those other secondary conditions are really a subset, so still need to be a diabetic or have a certain BMI, with the one exception being MASH. So there's a new indication for MASH for Wegovy. It's a liver disease. But the good news there is there was previously a drug called Resdifra that was the only option on the market, and it's about 4 times more expensive than Wegovy. So looking at that, our team made a change and we said we will cover Wegovy for this MASH indication because ultimately leads to a lower net cost for our plan sponsors as well. So I know there's a lot there, lots of hot topics, so I'll pause again just to see if there's any other questions. All right, not hearing anything, I'll send it back to Greg.
Thank you, Brian. I'll go back here real quick to implementation, client success, and we'll finish on just with some advantages of the Rightway BHCG partnership. So I talked about implementation. If you were to choose to partner with Rightway, every client gets a designated implementation manager to run and do the heavy lifting on your behalf. They're the quarterback, so to speak. They go internally within Rightway and they pull in the necessary SMEs from all of our other various departments, be it IT, be it benefits, be it coding, and they run the project plan. We structure our implementations off a very detailed project plan. We use a green, yellow, red scenario to monitor how we're tracking throughout the whole implementation. As I mentioned earlier, we really start with meeting with you. Like, what are your goals with your pharmacy program? Because oftentimes when you switch vendors, it is a good opportunity to review and potentially make changes as well within your benefit design. The other thought pattern is, let's not change anything. Let's just switch over to the new vendor, get things up and running, and then we can do it later on, which we're comfortable with both, but our goal is to try to be proactive and help you identify how you want your plan set up. We work with all the other external vendors. Again, we'll work with your previous PBM to get all those files I talked about. We'll determine what other third-party vendors of yours may need data integration with Rightway. Oftentimes it's your carrier or TPA. From an accumulator perspective, if you use a different party for eligibility, we would obviously get that set up with them. So whatever other third parties you work with, our team would build that into the project plan. And then I talked about member engagement too, right? We do a very robust member communication program to reach out to them all through multiple different modalities. What else was I going to say? I just lost my train of thought there, but hopefully it'll come back to me. We have numerous other on-site materials that we can work with you as the plan sponsor. And ultimately, at the end of the day, our goal is to do all the work for you and your benefits team. We do pull you in for guidance, for oversight, for direction, but at the end of the day, we're going to do the work on your behalf. Typically, for a PBM implementation, we'd like 90 days. If you gave us more time than that, we'd obviously take that in a heartbeat, of course. If we had to do a shorter implementation time frame, it has happened. I think our record was a 45-day implementation. Now, mind you, we don't seek those out by any means, but my point being, we're able to do a shortened one if the circumstances dictated that. From a client success perspective, I just want to give you a visual. Your actual team per client, and depending on your timing, if you were to partner with Rightway, may vary from the names you see here, but not the titles. Peter is consistent. Chris, who's on the call, works and reports up through Scott. So they would be your executive sponsor that you would get for any BHCG client. Peter oversees our whole client success team. Excuse me. But each individual client would get what we call a director of CS, director of client success. And then we have more of a day-to-day just client success manager to help with the more administrative circumstances that you may have, an eligibility issue, a prior authorization issue, a claim rejecting issue. And then Brian and his team from a clinical consulting perspective, implementation, they typically will fall off the account 30 to 60 days post go live. We understand there can be issues with every implementation, so we want to keep them on for consistency and be able to ensure that things are running like they're supposed to. All clients will get access to our client portal. This is, for those of you old enough, it's like the Britannica encyclopedia of information that gives you a ton of power and information at your fingertips. You can run your own reports. That's often a big knock on the PBM industry is we don't even get reports. We don't have access to our data. We're the opposite. We want to give you access to your data. It's your data. Not only will we kick out monthly and quarterly reports to you, standard reports, but you can go into the client portal at any time to run your own. You can do eligibility updates. You can find marketing materials through our client portal. And then, as I mentioned earlier, we are in the process of creating a scenario modeling tool. We have it in, I think, beta right now, but it should be ready, I think, for all clients for 1/1/27 and beyond. Where let's say you want to add weight loss coverage, or you want to exclude weight loss coverage or diabetes or any other drug for that matter, you can do some predictive modeling within the client portal as well. Any questions from an implementation or client success perspective? Great. I'll finish, and then we can open up the last couple minutes for any question. Just some of the advantages that we feel we bring to the table, right? Fiduciary alignment is a big one. That is like the hot word, right? Transparency has been the hot word for the last 10 years, but transparency means different things to different PBMs. For Rightway, transparency means the only way that we generate revenue is through a straightforward per member per month admin fee. That is the only way. And of course, if you were to implement any of our ancillary programs, weight loss, diabetes, etc., they copay assistance, patient assistance, they have their own fee tied to them, but they're all voluntary. And we think that helps. And by not owning our own distributing assets, we think that naturally aligns with our fiduciary role, or to help you in your fiduciary role as a plan sponsor better than our competitors can. So kind of touched on those two. We talked about our advanced technology. We talked about on a quarterly basis, Brian and our client success team will come to the table with proactive ideas by looking at your data and proven results. At the end of the day, we have averaged over 15% average savings in year one, with high NPS scores, net promoter scores. I'm assuming most of you are familiar with that. The PBM industry as a whole, I think, is in a net negative territory right now, last I heard. To have 70 and above consistently, we feel that our member obsessed model is working. There's no consulting fees built into the BHCG model. Now, mind you, we understand that all of you work with different consultants. They may have their own fees, but through this relationship with BHCG, there are none built into that. You have the abilities to audit annually. We're one of the few PBMs that lets you audit our rebate agreements down to the NDC level. Most PBMs do not allow that. Again, we're like, it's your data that you should be able to see how our program is set up. We've built in an $8 per member implementation credit to help with any expenses you may incur by moving to Rightway. And the most common expenses that a plan sponsor will incur is sometimes the previous PBM will charge data file feed prices. Like, they've been all over the board. I've heard from $1,000 for this file to $10,000 for this file. But at the end of the day, any expense you incur by moving to Rightway can be drawn off that $8 implementation credit. And then we recently, I'm hoping Janet can attest, the big reason they chose Rightway is we wanted to create a partnership, right? Janet shared that was kind of maybe a struggle. So what we did is we built in a growth credit. Our goal is to help BHCG grow, help you guys all grow cumulatively together, that as you reach certain growth tiers, we kick back a credit to all of the participating member groups. We're still finalizing the actual dollar amounts. We feel it's relatively significant, but Janet will be able to share that with you here soon. with that, I know it's 11:56. I think we squeezed that all in an hour, which is great. We can just open up, the remaining 4 or 5 minutes for any questions you guys may have.
I'm just going to add an added benefit to the Rightway BHCG piece is honestly as becoming a member of the business healthcare group. This group is highly collaborative. We will have a Rightway user group that we're establishing starting this summer. And that group just allows employers who are utilizing vendor partners that we've selected to come together and talk about best practices and shared experience, and also have that funnel back to the dedicated resources that we have from Rightway to ensure that your experience is excellent with minimal work from your very, very busy teams, quite frankly. So. If there
Anybody have
are
anything, we can stay on as long as you need us. And feel free, if you think of something after this call, obviously funnel it through Janet. She'll get it over to our team. We'll get an answer for you as quickly as we can. But thank you so much, Janet, BHCG team, for giving us the opportunity to get in front of you guys all today. We truly appreciate it.
Yeah, thank you. All right. Thanks, guys.